Today, our topic is how Lehigh Valley Health Network and others are increasing revenue while addressing patient affordability. It's going to be presented by John Fissner of AblePay and Jeff Hinkle. Thank you both for partnering with us in this series. We appreciate it, and I'll turn it over to you at this time.
Okay, thank you very much, AC. I appreciate KHAM for having us to present today. I'm just bringing up the presentation now and share with everyone. We also have Kelly Hooper from the AblePay team here on the call as well.
Otherwise known as Beyonce.
I'm sorry, Kelly.
No, I'm kidding.
That's all good.
AKA Beyonce.
Yeah. So again, thanks for taking the time today. Let me first introduce Jeff Hinkle. Jeff, you want to give a little bit of background on yourself and Lehigh Valley Health Network?
Sure. Thanks, John. My name is Jeff Hinkle. I'm the Vice President of Patient Financial Services for Lehigh Valley Health Network. Been with the organization going on 21 years. We are a $4.5 billion net patient revenue network located in northeastern Pennsylvania. Currently 13 hospitals, north of 1,600 physicians, and north of 20,000 employees. Worked with AblePay, as we'll discuss, for several years now, and appreciate your time and happy to answer any questions you may have after the presentation.
Thanks, Jeff. For those who don't know me, I'm John Fissner. I'm the founder and CEO of AblePay. My background, I was a former health system CFO and chief operating officer in Allentown, Pennsylvania, right now, actually not far from Jeff. Grew up in the area and came up through a local health system, and then I left in 2012 and started my first company, which is called JDR. JDR is just my kids' initials, Jack, Dylan, Ryan. They're 14, 13, and 12. And we are currently in full AAU basketball season with 7 teams for 3 kids. So I'll be driving to Pittsburgh tomorrow to the convention center for a big tournament. JDR just helps hospitals in Pennsylvania with workers' comp reimbursement. And for those that were on in the beginning, I was talking to Jeff a little bit about that. We still have that company. In 2016, I decided that there was an opportunity to create something bigger, create something on a national scale, and do it in a way that would impact both providers and patients and lower the cost of healthcare overall. And it really came out of my personal experience when I was the CFO and seeing things change pretty dramatically, and from a cyclical standpoint at the beginning of the year with copays, deductibles, and coinsurance. I didn't think the solutions out there were really moving the needle. I felt in many ways they were Band-Aids in 2 different structures. One would be the banks that were involved. So the banks, they're in a position where typically they have to charge interest to either both the system or the patient, and that adds cost to a system that's already pretty expensive. And then the other companies that were involved were really patient engagement tools, right? So they made it easier to pay. But I felt that if we changed patient payment behavior, that would be the biggest impact to the system overall. Some challenges. Let me just move around here. Challenges that we're all seeing. So patient out-of-pocket costs are rising. So these are kind of the macro issues. There's delays and defaults in payments. The collectible percentage continues to go down as deductibles, coinsurance rise. The education is a big issue. So less than 50% of people know what a copay is. So if you don't know what something is, it makes it harder to write a check for it. It is unaffordable at this stage as we push more and more expense onto patients. And as I discussed, I didn't think the market solutions were solving my problem when I was the CFO. So we came up with a solution. You can kind of think of AblePay in 2 pieces, right? So one is for patients, and then the other is from a provider's perspective. There's actually 2 agreements. One is a contract with the provider, and there's a contract with the patient as well. So from a patient's perspective, it was important that from for me that we actually lowered the cost of healthcare. So patients do get up to a 13% savings with every AblePay claim that comes in from their provider. There's no interest cost. There's no additional cost to patients at all. There are no fees to become a member. We wanted to give them access to make care more affordable, flexible payment terms, surround them with a team of advocates. So we say typically people sign up for AblePay because they can save money, but they actually stay with us because the advocacy team, right, that we're able to educate them and make them more aware about their bills and help them understand this whole very complicated process. As we all know, it was important that we accept everybody, right? So regardless of your financial situation, you're accepted into AblePay. So any patients that come in through our system from our current partners or potential partners in the future, they're all accepted, and we don't even actually credit check them at all, and there's no hit to their credit. And then we make it easy with a convenient portal for them to access for all their bills, regardless of where they go. From a provider's perspective, we wanted to dramatically move the needle, remove collection costs, make it non-recourse. I wasn't a fan personally of the recourse programs. We wanted to stop this issue of patients avoiding care due to cost. And when you do that, they actually get the care they need, which does drive more revenue. Along with the costs, reduce the days to collect, make it really easy to implement. So the way AblePay works is like a payer. So you can think of that processing in a very simple way. There's no big integration cost with us. You can simply put us in as a payer, as a secondary or tertiary into your system, Epic, Meditech, Cerner, doesn't matter what it is. And then we can move the money around just like if we were, again, Aetna or United or Blue Cross and Blue Shield. You can keep your current vendors. We have most of the competitive solutions in our market, whether they be banks or engagement companies. We are also at providers which they're there as well. So that's okay with us. You don't have to remove, change any current workflows or remove any vendors. And there's really no IT lift, right? It's just putting us in as a payer and then really becoming a marketing tool, a marketing solution, right? To get people to sign up for the program. So how it works, obviously we have a contract with a provider. That contract is at a discount off of the full bill, right? Providers offers AblePay directly to their patients. So we do that on a pre-service level. At the time of service and post-service. So we just say, hey, Kelly, you have an appointment tomorrow with Dr. Hinkle. You can sign up for AblePay today. It's pre-service at the time of service. And then most of our members actually sign up with us post-service when they have a bill and they're kind of motivated to pay and save money or create flexible payment terms. So they become members and then they present the cards at the time of service for care. So you can think of it just like presenting your insurance card. The bills will flow through us, 837 us, 835 back with an ACH transaction too. So you can reconcile that right in your system automatically. The provider bills AblePay. We pay the provider and the member pays us, right? So that's how it all works. It goes from provider to payer, back to provider, the claims process to AblePay, and then we're taking full risk on your patients that become our members. Just to give you some history, is back in 2017, our first client was St. Luke's University Health System. They're still a client. They're actually an investor. That was when we kicked off the program, 2016 from my idea. And then since 2017, we've been up and running. So little spoiler alert here with that next slide. But in 2018, I went to Jeff. Jeff is a competing health system with St. Luke's. They overlap markets here in the Lehigh Valley. As Jeff said, it's a big system. It's 4.5 billion in revenue, bigger than St. Luke's. And I certainly wanted to include them into the program as a participating provider. And I went to Jeff, and Jeff, you said, obviously, no, right? So what really drove the thought process at the time? Why weren't you interested in AblePay? And how'd you come to that conclusion?
Yeah, in 2018, when John approached us about this opportunity, we had several other initiatives that we were working on in the network at Lehigh Valley, and primarily our focus was on being able to, for our self-pay patients, being able to reach out to them via text, being PCI compliant. We were not at that point in time. So we were focused on partnering with a vendor that would afford us the ability to reach out to patients, send them a text message, have the patients being able to pay via text, and then also be able to take recurring payments, which we could not. So back then, we would send, if you were in a payment plan, each month we'd send you a statement, or through my LVHN, and we're a full Epic shop, so we were utilizing in my LVH portal to reach out to patients and inform them of their liabilities. So that was one of the primary focuses. We had a lot of irons in the fire with some other initiatives. And then, one of the other discussions that we had when John approached me was, why do I want to pay you for money that I'm already receiving? So as myself as an example, if I'm a patient, I'm going to pay my bill. So why would I give AblePay a portion of that those receivables when we could take 100% of those? So those were the primary factors that led me to telling John that we weren't interested at that point in time.
Yeah, Jeff, we hear that a lot. Like, one of the primary questions up front is we call it FOMO, right? Fear of missing out on somebody that might pay. And the way our program works, right, is because that person may have paid at 100% before, you can think of it as you might actually lose on that patient. But the rest of the people that sign up, right, far outweigh, especially those that weren't paying anything at all, which we'll talk about in a little bit, far exceeds the people that might not have paid. And all that really matters, I think, for all of us have been in rev cycle and finance, healthcare finance for a long time, is more cash, right? When it comes to these types of programs, along with the patient experience, which we discuss. So 2018, we added mainline along the way, and then ultimately, I'm calling it the comeback here, but I got Jeff to meet with me again. I'm rather persistent sometimes, and there was a different decision. So Jeff, ultimately, why did you decide to contract with AblePay in 2018 and change your mind from some of those concerns before?
Fast forward a year after our initial conversation, and when John came back to me, we had been receiving requests from patients through our customer service department, through registration, asking about this AblePay program, and why doesn't LVHN accept the program. So we started to look at it a little bit more, and in our conversation with John, I had ran some numbers, and I came up with that. At the time, they needed, in order for the program to be a win-win scenario for us, that John and his team would have to sign up patients north of 5.8% of the time that were in bad debt or had accounts historically in bad debt. So we looked at our bad debt numbers, we looked at our self-pay collections, and that's where we landed, in that they would have to hit that in order for us to be where we would stay at least a minimum break-even point. And so we talked through the contract, and we agreed on a model that would work for us, and we implemented the program. And with that, we were going to, and we did every month, evaluate where we were, the percentage of folks that they signed up that were in bad debt historically, and then the advancement of the program as a whole, month by month.
Okay, great, thank you. So what I kind of missed explaining before is that when we started AblePay, it was really an employee benefit, right? And we really had two choices at the time. One is try to market this directly to consumers, or kind of go through this employer model, because hospitals weren't really ready to start promoting us directly to all their patients. So at 4-year run with the employer model, you can see how the revenue continued to increase as we were signing up members in the community, and they were ultimately getting care at Lehigh Valley Health Network. So Jeff, during that time from 2018 to 22, as we were growing this employer model and trying to bring this idea of AblePay to market, what were you guys working on to try to improve this patient out-of-pocket collection issue?
As I mentioned, we were implementing at the time Patient Co. They're now Waystar to be our PCI compliance vendor, as well as utilizing the capabilities, functionality that they had for texting and statements. So we contracted with them, implemented that. We had acquired several facilities. Some of the physician practices that we acquired, they were using a program called Care Credit. The issue that we had with that, and still to this day, is the high percentage that is charged to the patient if they miss a payment. So we weren't not a big fan of that, because at the end of the day, we're trying to help our patients afford their bills or educate them on programs that they can utilize, whether it's our financial assistance program, a payment plan, or in this case, AblePay, that's not going to damage their credit and or have them incur additional fees that on top of what their responsibilities are already. So we rolled that out, and along those initiatives, along with AblePay, and we were had a pretty good response early on. But one of the things that we wanted to do was market it through flyers and through point of service registration means, through pamphlets and communication to the patients that face to face on how they could save dollars off of their patient responsibility bills.
Yeah, I think two things. One is it's important to know we've never sent anybody to third-party collections through AblePay. We've never hit their credit. So when I look at this program, I think of us in the same position as a health system, right? You want people to continue to come back. You don't want them to be hurt, especially when they can't afford to pay. Certainly, people don't pay their bills, right? So we have defaults, but we've been able to kind of weather that storm and not put them even in a worse situation than they were before, because they couldn't pay their bills. Second, which kind of leads to this discussion going forward. Jeff started talking about how we began to start promoting this. So as we grew, and we grew this as an employee benefit over time, you can see some of the logos there. We completed a case study with another health system to really prove that we were changing patient payment behavior, which led to Lehigh Valley deciding that they wanted to start promoting this directly. So I felt the best way to prove that we were actually moving the needle was to look back on the people we paid this health system on for 4 years, and said, okay, how did they pay you before they signed up for AblePay, and how, of course, did they pay after, which is from us in our standard model. So you can see on the top left, the increase over the historic collection rate was 50% at this health system. The increase in revenue going to the left per patient was 41%. So this was something that I was a little bit skeptical on. This means that, if they had averaged $100 in charges before, they were averaging 141 charges after they signed up annually for AblePay. So I was a little bit skeptical the first time we saw this. 17% had no prior services, meaning we brought 17% more revenue, or in this case, actually 17% more individuals to the hospital that never were seen before. On the top right, 32% previously paid nothing at all. So I mentioned that you're going to have some people that you might have gotten paid more, right? But when you add that with 32% of the revenue that paid zero, you end up netting out, and everyone in between, 50% improvement on the same people. 23% was already written off to bad debt and revenue. And then the reduction in days to collect was 97 days for this case study. So as a result of this, we switched to the provider direct marketing model. So we convinced our providers that it was time that not just growing this as an employee benefit, but you should be the best return, the best impact you can make is to start marketing this directly, which they did. And since then, we've grown pretty dramatically. So we're now up to 40 health systems throughout the country. Here's a sample for all of them. We're in 27 states. Right now, it doesn't matter the type of medical provider. Everyone from major system like Penn Medicine with multiple hospitals throughout Pennsylvania, New Jersey, to Lehigh Valley, to Altru in North Dakota, to children's hospitals to critical access centers to rehab hospitals to physician groups, right? It doesn't matter from our perspective. Anyone that has a deductible coinsurance copay can be part of the program. In addition to that, we've grown this hospital association partnership model dramatically. At the beginning of the year in 2023, I think we had one or two. And now throughout 2023 and into this year, we're up to 19 hospital associations that have vetted us and approved us and felt that this is a valuable tool that they should bring to their participating hospitals in their state to help with patient out of pocket, both for their health systems as well as their patients. Last couple of years, we've been on the fastest growing private company list for Inc. 5000 for 2021 results. 2022, we will be on this for 2023 as well, as we've continued to triple our size year over year. And all that kind of leads to what Jeff said, right? They decided it was time to start marketing to patients. You want to speak to a couple of these things, Jeff?
Yeah, thanks, John. Really, as we implemented the program, I was getting more and more feedback from our employees, the colleagues that I work with, that were expressing the satisfaction they have with the program, and had communicated to others the ease of use and what they liked about the program. So we continued to look for ways that we could market it internally, as well as external to our patients that were not colleagues of the network. Most recently, Epic has a program called Cheers Program that is a program that they created where you're targeting a population of patients for certain responses that you're looking for. So in this case, we're targeting patients that are not currently enrolled in AblePay. So any bills that are going out now, we are utilizing that Cheers Program survey and informing them of the program, texting them how they can save up to 13% on their out-of-pocket expenses. And John, if you want to share the numbers, the recent numbers, but the numbers been, and we just kicked that off a couple months ago here, but they've been a positive response so far, several hundred the first week or two that we kicked it off.
Yeah, we increased. Last month was we had 650 new members sign up for AblePay from Lehigh Valley last month, and then this month with the Cheers program, we already had 750 through April 15th. Right, so pretty dramatic growth in the program, because every person that gets a bill is also getting a text or email coming from the Cheers program.
Yeah, when John came back to me a year after we told him no, and I said, it has to be a win-win program. When I look at it now, I really look at it as a win-win-win program where, patients winning because they get a reduction on their fees or their patient responsibility. AblePay is, partnering with a large organization and able to sustain their employees through the fees that they get, and then the network itself. We win because there, a significant reduction in the expenses that we have on the back end. There are no credit card fees that we're dealing with patients through AblePay. The reduction on the patient statements, AR, self-pay AR decrease, bad debt collection expenses decrease, and it's really a program that, as I mentioned, is a win-win-win at this point for us.
Yeah, thanks. Jeff, could you talk just a little bit? I know you had concerns about the implementation process and the reconciliation. Did you, it says, obviously part of the decision, you thought that all worked out, but you can talk to people, because that's one of the objections we certainly have. They don't really believe a vendor when they say, look, you just got to put us in as a secondary payer. But what was your experience?
Definitely in my role, anyone on the call that's in my role, where you're constantly being solicited by vendors and being told that this program is very minimal lift for your staff, minimal IT resources, and then you sign the contract and you start to go down that path, and you realize that it's going to take you 200 hours of your resources in order to get the project or the software up and running. With AblePay, I can honestly say it has been the easiest implementation of anything that we've ever done here in the 20 plus years I've been here. As an Epic shop, the we created an Epic plan code, which is AblePay. So as John mentioned earlier in the presentation, they are like a insurance provider. So at registration, patient, if they have Blue Cross, we put in Blue Cross as primary, AblePay as secondary. They present, and after any patient liability that remains after primary or secondary insurance pays, we then drop a 837 file to AblePay. In turn, they give us an 835. The money's wired to the bank, and we post that. The logic in the system automatically takes our contracted rate deduction off the balance, and the account's at zero. So very minimal work that we've done in that regard to setting up AblePay in our system. The largest lift that we had was from our revenue cycle education team, and that was educating the registrars on this new program that we're implementing. That, coupled with working with our marketing department on materials that we're going to hand out and that we were going to put on our website, that was the biggest lift. And even with that, it wasn't a huge response or a huge undertaking for our team in order to get that up and running. So wouldn't risk my reputation on this, by far the easiest implementation that we've had with any of the vendors that we've dealt with.
Thanks, Jeff. So once we had some of this data, right, we were able to do the same case study, and we actually do this for all of our clients on a year-by-year basis. So it's a 4-year look back on everyone that we paid Lehigh Valley Health Network to determine, did we in fact change patient payment behavior? So top left, there was a 47% increase in collections on the same people. When we did this analysis, again, we saw that there was a 43% increase in revenue per patient. Now we felt more comfortable that this was consistent, and in a second I'll explain to you why we're kind of seeing this data that they're actually getting more care, or at least we're making the care affordable so they can get what the care that they need. 17% in this case had no prior services at Lehigh Valley. Top right, 38% previously paid nothing at all. So if I remember correctly, in the case study for Lehigh Valley, there was actually 55% of the people that previously paid at 100%. So even with high numbers of people that we signed up that were paying at 100%, there was still a 50% increase on the same people, because on the back end, there was 38% that were paying nothing at all on their bill. 23% had prior bad debt as well, and there was an 83-day reduction in days to collect. So I mentioned that concern with the additional services, and we really went back to our members, and we do a lot of surveying with our members, getting their feedback on the program and how we're changing their behavior and why are they interacting with us that way. So one of the questions we had to try to address this additional service question is, prior to AblePay, did you ever forego or postpone receiving care due to the cost? So 31% of our membership said they did, right? Now that you have the financial security and protection, have you received care that you otherwise wouldn't have because of AblePay? And 20% said yes. So those are the ones that are really driving the additional services. These are specific patient experience results at Lehigh Valley. You can see at the bottom left, we asked 3 questions on every person that enrolls in AblePay. So we have a baseline result for them. There's 3 questions: ease of understanding your bill, timely response to questions or concerns, and then overall satisfaction of the billing process. And you can see the gains there. So once we ask that question again, they have the services, and I think I shared, Jeff, like all of the responses for everyone that responded with their feelings about AblePay, good, bad, or indifferent. But in these particular cases, 58% increase in ease of understanding your bill, timely response 76, and a 75% increase in their overall satisfaction. AblePay's net promoter score across the board is a 69, which is really high, but specifically with patients that came from Lehigh Valley or had services for Lehigh Valley, it's been 89. So even much higher on the patient experience side. Jeff, I don't know if you want to add anything from your side on the experience.
Yeah, and I mentioned it before, managers come to me, other colleagues that really expressed their satisfaction with the program and how easy it was to sign up and how easy it was to use. Originally, In full transparency, I didn't sign up. I've been, relatively healthy, and I try to take care of myself as best I can. But in any case, when I did start in need, had some sports injuries and required some services, so I took advantage of the program. And personal experience, it was literally 2-3 minutes to sign up, and I get a text now when I have a bill. I can pay it right via my phone, and it's done in a heartbeat. And so it is very simple to use. Very pleased with the program, and like I said, I've had a lot of positive feedback from folks that I work with that are members of AblePay as well, that they love the program.
Thanks, Jeff. We're gonna have to get you back on the softball field again soon with that.
Something about that.
So just to give you an idea, so you can see when we start scaling this and providing this directly to Lehigh Valley Health Network's members, you can see how this has grown pretty dramatically. And I'd say we're right about on pace for those numbers that you see for this year. And then we expect the program grow into 2025 as well. The way we look at this, right? So 1,000 members. So really couple components. One is the collectible percentage change, which is significant. The additional services, which is even more significant than the collectible percentage change. And then in the case of Lehigh Valley, which admittedly doesn't happen at every organization or every market, they got a benefit too from new people coming to Lehigh Valley that were never seen before, that were our members. So for every 1,000 members, it's about $1 million in net impact for an organization. And because of the increase in the Cheers program, that's about 1,500 new members a month. So it's about a $1.5 million impact per month at Lehigh Valley. So future of AblePay at LVHN. I know we talked about a couple of those things here, Jeff, but anything you want to add that we're looking at?
Yeah, really, we talked about, eventually looking at open enrollment. Do we include that in as an option for open enrollment? We talked about the Cheers program, and obviously continued outreach to patients when they call in for assistance with their, needing assistance with their bills, or looking for forgiveness on their bills. We also looked at and continue to look at our payment plans. Is there an opportunity there to transition our payment plans from managing them internally to utilizing AblePay and the resources they have, enabling the patients to work the balances through AblePay, and also get a discount on the outstanding balances.
Great. Thanks. So that's the end of our presentation here, but Jeff and I are certainly available for any questions you have about the program. Thank you.
Thank you.
Does anyone have any questions for them? A quiet group today.
I mean,
Great.
Well, thank you, John, Jeff, and Kelly, aka Beyonce. We appreciate you guys partnering with us again, to do these webinars, and for definitely the insight and how AblePay helped at Lehigh Valley, and the response from your patients and from your facility. We appreciate all the information.
I just see Mandy on, and not to call her out, but Mandy, do you have anything? We've had a couple dialogue. Maybe it'll benefit the group, or while we have Jeff and John on. She'll love me for this.
Oh, she will. She will. It's
She'll-
coming.
She'll get me back for this one, but she might not
sure.
also. Hi, Mandy. She might be multitask. Oh, no, not so much. Well, she'll get me back that way too. How about you, AC? Anything for you?
No, I'm good, actually. I'm
Okay.
good. It was very insightful on how you all worked with the Epic to make this happen. I was more interested in how the time it took to implement. It was not, an extreme amount of time, because I do work with a lot of implementations. And you're right. They always say, oh yeah, it only takes so many man hours. And that doesn't seem to be true unless IT's at the table. It's always something different. So
Yeah,
Yeah.
you could literally set this up in Epic, from the Epic component of it in less in a day, less than a day, to sort of create a plan codes, add it in and put the logic in for the discount. And like I
Yeah.
said, the biggest lift was the marketing component of it, reviewing the verbiage and getting that approved through marketing and educating the staff on the program and what to say when the patients ask for assistance.
The education is really the easy part. It's the configuration and making sure the right information is coming in and going out, in my perspective.
Yeah. And I think when when I went to St. Luke's, this was back in 2016, I had this idea to roll this out. They came back and said, hey, you got to figure out a way to make it work in Epic. And really working with them, we settled in on, hey, why don't we be a payer? Even though we're not a payer, like, why don't we act like a payer so we can move this around very, very easily, which I thought was a different solution, and still, in the market as a different solution to move this money around as a claim and not, dealing with it as a statement. So.
Yeah.
All right.
Okay.
Well, thanks so much. You can certainly reach out to me directly, or Jeff's available. You can hit him up too, as long as he's not, playing softball. But appreciate the time today. Thanks for having us, AC, and
No problem.
and we're here if you have any questions. Okay.
All right. Thank you
Yeah.
all. We appreciate your time.
Thank you.
Have a
Take care.
great weekend.
Close
You too.
again.
Okay.
Bye.